Nremt, EMT Basic, Exam Prep 2026. This is the part of the complete course. You can get the link in description how to learn this quickly. Hey, welcome to the course. Before we start, let me tell you how to pass this test. Don't just memorize the answers, try to understand why we do things. Imagine you are standing next to me, and we are looking at a real patient. When I ask a question, pause, think about what you would do in real life, and then look at the answer. We will keep it simple, clear, and direct. You got this. Section 1. Airway, respiration, and ventilation. All right, let's talk about the airway. This is the starting point for everything. If a patient cannot breathe, nothing else matters, because they will not survive. When you walk up to a patient, the very first thing you look for is chest rise. Are they moving air? If the patient is talking to you, that is a great sign. It means their airway is open. But if they are unconscious, the tongue is the most common thing that blocks the airway. Gravity pulls the tongue back, and it blocks the throat. So, we use the head tilt, chin lift maneuver. It is simple, you pull the forehead back, and lift the chin. But, wait. If you think they fell or hurt their neck, do not twist the head. Use the jaw thrust instead. This keeps the spine safe. Now, let's look at tools. We have the OPA and the NPA. The OPA goes in the mouth. But you can only use it if the patient has no gag reflex. If they gag, take it out, or they might vomit. The NPA goes in the nose. You can use this even if they are awake. But never use an NPA if the head is smashed or there is a bad skull injury. We also need to talk about oxygen. If a patient is having trouble breathing, but is still moving air okay, we give them oxygen with a non-rebreather mask. Set it to 15 liters per minute. But if they are barely breathing, or breathing too slow, oxygen is not enough. You have to breathe for them. We use a BVM, or bag valve mask, for that. Squeeze the bag once every 6 seconds for an adult. Do not squeeze too fast, or air goes into the stomach, and that is bad. Finally, suction. If you hear gurgling, that means there is fluid. You must suction it out. But be careful, do not suction for more than 15 seconds at a time. If you do it too long, you steal their oxygen. Practice questions 1. You find a patient unconscious and snoring. What is the likely cause? Answer: the tongue blocking the airway. Explanation: snoring sounds in an unconscious person usually mean the tongue has fallen back against the throat. 2. How do you measure an oropharyngeal airway, OPA? Answer: from the corner of the mouth to the earlobe. Explanation: this ensures the device is the right length to hold the tongue forward without pushing the epiglottis down. 3. A patient has a gag reflex. Can you use an OPA? Answer: no. Explanation: an OPA will cause them to vomit if they have a gag reflex. Use an NPA instead. 4. How long should you suction an adult's airway? Answer: no more than 15 seconds. Explanation: Suctioning removes air too. Doing it longer causes hypoxia, low oxygen. 5. You see a patient with a head injury who needs airway help. Which maneuver do you use? Answer: jaw thrust maneuver. Explanation: this opens the airway without moving the neck, protecting the spine. 6. What is the flow rate for a non-rebreather mask, NRB? Answer: 10 to 15 liters per minute. Explanation: you need enough flow to keep the reservoir bag inflated so they get high oxygen. 7. A patient is breathing 6 times per minute. What do you do? Answer: ventilate with a BVM, bag valve mask. Explanation: 6 breaths is too slow. They need you to breathe for them to stay alive. 8. What sound indicates fluid in the upper airway? Answer: gurgling. Explanation: air passing through liquid makes a gurgling sound, which means you need to suction. 9. How do you measure a nasopharyngeal airway, NPA? Answer: from the tip of the nose to the earlobe. Explanation: this gives the correct length to reach the back of the throat through the nose. 10. What is the main sign of choking in a conscious adult? Answer: silent coughing or holding the throat, universal sign. Explanation: if they cannot speak or cough forcefully, the airway is fully blocked. 11. Which oxygen tank is the portable size usually carried in the field? Answer: D cylinder. Explanation: D cylinders are small enough to carry to the patient. M or H tanks stay in the truck. 12. When using a BVM on an adult, how often do you squeeze the bag? Answer: every 5 to 6 seconds. Explanation: this matches the normal breathing rate of 10 to 12 breaths per minute. 13. A patient has a stoma and needs help breathing. Where do you place the mask? Answer: directly over the stoma, hole in the neck. Explanation: they breathe through the neck, not the mouth, so the air must go there. 14. What indicates that your artificial ventilations are working? Answer: the chest rises and falls. Explanation: visible chest rise is the best proof that air is actually entering the lungs. 15. What is the main risk of ventilating too fast? Hyperventilation. Answer: gastric distension, air in the stomach. Explanation: extra air goes down the esophagus into the stomach, which can cause vomiting. 16. A patient has low oxygen saturation, SpO2 88%, but is breathing normally. What do you do? Answer: give oxygen via non-rebreather mask. Explanation: they have a patent airway and good drive, they just need more oxygen in the air. 17. What lubricant do you use for an NPA? Answer: water-soluble lubricant. Explanation: oil-based lubricants can damage the tissue or the lungs. 18. You hear a high-pitched, crowing sound, stridor. What does this mean? Answer: upper airway obstruction or swelling. Explanation: stridor usually comes from swelling in the larynx, common in allergic reactions or croup. 19. When inserting an OPA, how do you start? Answer: insert it upside down, tip facing roof of mouth, then rotate 180 degrees. Explanation: This stops the tip from pushing the tongue back into the throat during insertion. 20. What is the normal respiratory rate for an adult? Answer: 12 to 20 breaths per minute. Explanation: this is the standard healthy range for a resting adult. Section 2. Cardiology and resuscitation. Now, we move to the heart. Think of the heart as a simple pump. It pushes blood to the lungs to get oxygen, and then to the body to feed the cells. If the pump stops, the cells die. When you find someone with no pulse, you are the pump. You must start CPR immediately. Do not hesitate. Put the heel of your hand in the center of the chest, and push hard. You want to go at least 2 inches deep. And you need to be fast, between 100 and 120 times a minute. If you stop pushing, blood pressure drops to 0 instantly. So, minimize interruptions. The aid is your best friend here. It is a machine that shocks the heart to reset the rhythm. As soon as the aid arrives, turn it on. Listen to the voice. It will tell you where to put the pads. Upper right chest, one on the lower left side. If the machine says, "Shock advised," make sure no one is touching the patient, and press the button. We also deal with chest pain. This is usually angina or a heart attack. The patient might feel pressure, like an elephant sitting on their chest. We help them take aspirin if they can chew, and nitroglycerin if it is prescribed to them. Aspirin stops clots from getting bigger. Nitro opens up the blood vessels. But, be careful with nitro. If their blood pressure is low, below 100 systolic, do not give it. It will make them pass out. Always ask about ED medications, like Viagra. If they took that recently, and you give nitro, it can kill them. So, ask the awkward questions, it saves lives. Practice questions 1. What is the correct compression rate for CPR? Answer: 100 to 120 compressions per minute. Explanation: this speed creates the best blood flow without tiring the heart muscles too much. 2. What is the first thing you do when the aid arrives? Answer: turn it on. Explanation: the machine will guide you, but it cannot help until it has power. 3. What is the compression to breath ratio for an adult CPR? Answer: 30 compressions to 2 breaths. Explanation: this ratio keeps blood moving while still providing some oxygen. 4. When do you stop CPR? Answer: when the patient moves, the aid analyzes, or you hand over care. Explanation: stopping for any other reason causes blood pressure to drop. 5. A patient has chest pain and a BP of 90/60ths. Can you give nitroglycerin? Answer: no. Explanation: nitro lowers blood pressure. Since 90 is already low, giving it is dangerous. 6. What is the medication dosage for baby aspirin in chest pain cases? Answer: 162 to 324 milligrams, usually 2 to 4 baby aspirins. Explanation: this is the standard dose to help prevent blood clots in a heart attack. 7. Where do you check a pulse on an unconscious adult? Answer: carotid artery, neck. Explanation: this is the strongest pulse point and the last to fade when pressure drops. 8. Where do you check a pulse on an infant? Answer: brachial artery, upper arm. Explanation: Babies have short, chubby necks, so the arm is easier to feel. 9. What heart rhythm does the aid shock? Answer: ventricular fibrillation, VFib, or ventricular tachycardia, VTach. Explanation: these are chaotic rhythms where a shock can reset the heartbeat. It does not shock a flat line. 10. How deep should chest compressions be for an adult? Answer: at least 2 inches. Explanation: you need to squeeze the heart between the sternum and spine to move blood. 11. After the aid delivers a shock, what is your next immediate step? Answer: resume chest compressions. Explanation: do not check for a pulse immediately. The heart needs help pumping even after a shock. 12. What implies that a patient is in cardiac arrest? Answer: unresponsive, no breathing, and no pulse. Explanation: these 3 signs confirm the heart has stopped. 13. Why do we let the chest recoil, come back up, fully during CPR? Answer: to let the heart refill with blood. Explanation: if you lean on the chest, the heart cannot fill up, so the next pump pushes nothing out. 14. A patient has a nitroglycerin patch on their chest. You need to use the aid. What do you do? Answer: remove the patch and wipe the skin. Explanation: the shock can burn the skin if it goes through the metal or medication in the patch. 15. What is the compression ratio for 2 rescuer infant CPR? Answer: 15 compressions to 2 breaths. Explanation: babies need more oxygen, breaths, and have faster rates, so we switch the ratio. 16. What is the most common cause of cardiac arrest in children? Answer: respiratory failure. Explanation: kids usually stop breathing first, and then their heart stops. Adults are the opposite. 17. How often do you switch compressors during CPR? Answer: every 2 minutes, or 5 cycles. Explanation: compressions are hard work. Switching prevents fatigue and keeps compressions high quality. 18. What is return of spontaneous circulation, ROSC? Answer: when the patient gets a pulse back and starts to breathe or move. Explanation: this means your CPR worked and the heart is beating on its own. 19. You are performing CPR and feel ribs crack. What do you do? Answer: keep doing compressions properly. Explanation: breaking ribs happens. It is better to have a broken rib and be alive than be dead. 20. What is the maximum time you should interrupt compressions for? Answer: 10 seconds. Explanation: any longer than that and the brain starts to starve of oxygen again. Trauma is simple: it is physical injury. Someone got hit, cut, burned, or fell. The biggest killer in trauma is shock. Shock happens when the body cannot get blood to the organs. Your first job in trauma is to find bleeding. If you see bright red blood squirting, that is arterial bleeding. It is bad. Put direct pressure on it with your gloved hand. If the bleeding does not stop, or if it is on an arm or leg, use a tourniquet. Twist it until the bleeding stops. Next, look for broken bones. We call these fractures. If a bone is broken, it hurts and can cut the inside tissues. We splint it to stop it from moving. Always check for a pulse, movement, and sensation, PMS, in the hand or foot before and after you splint. If the limb is cold and has no pulse, you might need to pull it gently to straighten it once to get blood flow back. Burns are another type of trauma. We worry about infection and fluid loss. If the burn is dry, cover it with a dry, sterile dressing. Do not put ice on a big burn, it causes hypothermia. And do not pop blisters. Finally, protect the neck. If a patient fell off a ladder or got in a car crash, assume their spine is broken. Put a collar on them and secure them to a board or stretcher. If they vomit, log roll them on their side so they do not choke. Practice questions 1. What is the first method to control external bleeding? Answer: direct pressure. Explanation: pressing directly on the wound closes the vessel and helps a clot form. 2. Direct pressure fails to stop bleeding on a leg wound. What is next? Answer: apply a tourniquet high and tight. Explanation: a tourniquet cuts off all blood flow to the limb and is the best way to stop massive bleeding. 3. What are the 3 components of the Glasgow Coma Scale, GCS? Answer: eye-opening, verbal response, motor response. Explanation: these 3 areas tell us how well the brain is functioning after an injury. 4. A patient has a piece of metal stuck in their chest, impaled object. What do you do? Answer: stabilize the object with bulky dressings. Do not remove it. Explanation: removing the object will uncork the wound and cause massive, uncontrollable bleeding. 5. What is a sign of a basilar skull fracture? Answer: bruising behind the ears, Battle's sign, or around the eyes, raccoon eyes. Explanation: this bruising indicates blood is pooling inside the skull or near the brain stem. 6. What is the rule of nines used for? Answer: to estimate the percentage of body surface area burned. Explanation: it divides the body into sections of 9% to quickly calculate burn severity. 7. A patient has an open chest wound that is bubbling. What is the treatment? Answer: apply an occlusive dressing, airtight seal, taped on 3 sides. Explanation: this stops air from being sucked into the chest cavity, which would collapse the lung. 8. What is the classic sign of a hip fracture? Answer: the leg is shortened and rotated outward. Explanation: the muscles pull the broken bone, causing the leg to look shorter and turn out. 9. When do you remove a helmet from a trauma patient? Answer: only if it blocks the airway or prevents you from doing CPR. Explanation: removing a helmet can hurt the neck, so we leave it on unless it interferes with breathing. 10. What is shock hypoperfusion? Answer: inadequate circulation of blood to the body's tissues. Explanation: the organs are not getting oxygen, and waste is building up. 11. What are the signs of compensated shock? Answer: tachycardia, fast heart, pale skin, sweating, and anxiety. Explanation: the body is fighting hard to keep blood pressure up by beating faster and clamping vessels. 12. How do you treat an abdominal evisceration, intestines coming out? Answer: cover with moist, sterile dressing, then an occlusive dressing. Keep legs bent. Explanation: the moisture keeps the organs alive. Bending legs relaxes stomach muscles. 13. What is a flail chest? Answer: 2 or more ribs broken in 2 or more places. Explanation: a section of the rib cage breaks free and moves the opposite direction of the rest of the chest. 14. How do you transport a pregnant trauma patient in her 3rd trimester? Answer: tilted to the left side. Explanation: this moves the baby off the vena cava vein, allowing blood to return to the mother's heart. 15. What does the acronym DCAPBTLS stand for? Answer: deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, swelling. Explanation: this is the checklist used during a physical exam to find injuries. 16. A patient has a nosebleed, epistaxis. How do you treat it? Answer: lean him forward and pinch the fleshy part of the nose. Explanation: leaning back makes them swallow blood and vomit. Leaning forward lets it drain out. 17. What is the pulse check location for a conscious trauma patient? Answer: radial pulse, wrist. Explanation: if they have a radial pulse, their systolic blood pressure is likely at least 80 to 90 millimeters of mercury. 18. What is a hematoma? Answer: a collection of blood under the skin, a really bad bruise or lump. Explanation: a blood vessel broke and created a pool of blood beneath the tissue. 19. When should you use a traction splint? Answer: for a closed, mid-shaft femur fracture only. Explanation: it pulls the thigh muscle to align the broken femur bone. Do not use for knees or hips. 20. What is neurogenic shock usually caused by? Answer: spinal cord injury. Explanation: the nerves that control blood vessels are cut, so vessels dilate and blood pressure drops. Section 4. Medical emergencies. Medical emergencies are tricky because you usually cannot see the problem. It is happening inside the body. You have to be a detective. You need to ask questions, look at the clues, and fix what you find. Let's start with diabetes. This is all about sugar. The brain needs glucose, sugar, to work. If it drops too low, we call it hypoglycemia. The patient will act drunk, confused, or aggressive. Their skin will be cool, pale, and clammy. This is an emergency. If they can swallow, give them oral glucose. It works fast. If the sugar is too high, hypoglycemia, the skin is warm and dry. They might smell like fruit or nail polish remover. This happens slowly, over days. Next is seizures. A seizure is an electrical storm in the brain. The patient will shake uncontrollably. Do not hold them down. Do not put anything in their mouth. Just move furniture away so they do not get hurt. After the shaking stops, they will be very sleepy. This is called the postictal state. Just monitor their airway and let them rest. Then we have strokes. This is when blood flow to the brain stops. Use the FAST test. Face: does it droop? Arm: can they hold both up? Speech: is it slurred? Time: call 911 fast. Time is brain muscle. We also see lots of allergic reactions. If it is just a rash, it is mild. But if their face swells and they can't breathe, that is anaphylaxis. You must use an EpiPen immediately. It opens the lungs and raises blood pressure. Finally, overdoses. If someone took too many pain pills or heroin, opioids, their pupils will be tiny, like pinpoints. They will breathe very slowly or stop. We give them Narcan, naloxone, to wake them up. Practice questions 1. What are the classic signs of hypoglycemia, low blood sugar? Answer: cool, pale, clammy skin and altered mental status. Explanation: the body is in shock because the brain is starving for fuel. 2. A patient is having a seizure. What is your priority? Answer: protect him from injury. Explanation: you cannot stop the seizure, but you can stop them from hitting their head on the floor. 3. What is the Cincinnati Pre-Hospital Stroke Scale? Answer: facial droop, arm drift, abnormal speech. Explanation: these 3 tests quickly identify if a stroke is happening in the brain. 4. A patient has hives, low blood pressure, and wheezing. What is this? Answer: anaphylaxis. Explanation: this is a severe allergic reaction that involves multiple body systems, skin, lungs, heart. 5. What medication reverses an opioid overdose? Answer: naloxone, Narcan. Explanation: it blocks the drug from the brain receptors, allowing the patient to breathe again. 6. What is a transient ischemic attack, TIA? Answer: stroke-like symptoms that resolve on their own within 24 hours. Explanation: it is a mini-stroke or warning sign. The blockage clears itself, but a real stroke often follows later. 7. A diabetic patient has warm, dry skin and deep, rapid breathing. What is this? Answer: diabetic ketoacidosis, DKA, hyperglycemia. Explanation: the body is trying to blow off acid caused by high sugar, so breathing gets fast, Kussmaul respirations. 8. How do you administer an EpiPen? Answer: inject into the lateral thigh, side of the leg, and hold for 10 seconds. Explanation: the thigh muscle is large and absorbs the medicine quickly. 9. What is syncope? Answer: fainting. Explanation: it is a temporary loss of blood flow to the brain, usually caused by standing up too fast or fear. 10. A patient complains of a tearing pain in their back. What might this be? Answer: aortic aneurysm. Explanation: the main artery, aorta, is weak and tearing. This is life-threatening. 11. What organ produces insulin? Answer: the pancreas. Explanation: insulin is the key that opens cells to let sugar in. 12. What does postictal mean? Answer: the recovery period after a seizure. Explanation: the brain is exhausted, so the patient is confused or asleep. 13. A patient has overdosed and has pinpoint pupils. What type of drug did they take? Answer: an opioid, narcotic, heroin, fentanyl, oxycodone. Explanation: opioids cause the pupils to constrict tightly. 14. What is the contraindication for giving oral glucose? Answer: unconsciousness or inability to swallow. Explanation: if they cannot swallow, the gel will go into their lungs and choke them. 15. What are Kussmaul respirations? Answer: deep, rapid breaths. Explanation: the body uses these to get rid of acid during a diabetic emergency. 16. What is status epilepticus? Answer: a seizure lasting more than 5 minutes, or back-to-back seizures without waking up. Explanation: this is a dire emergency because the brain is not getting oxygen. 17. What usually causes a stroke? Answer: a blood clot blocking an artery in the brain. Explanation: this is an ischemic stroke. Hemorrhagic strokes, bleeding, are less common. 18. A patient is acting drunk but smells of alcohol. What should you still check? Answer: blood glucose level. Explanation: low blood sugar looks exactly like intoxication. Never assume they're just drunk. 19. What is the dose for an adult EpiPen? 3 mg. 15 mg. 20. What is a febrile seizure? Answer: a seizure caused by a sudden high fever, usually in children. Explanation: it looks scary but is usually harmless if the child cools down. Section 5. Ob, Gyn and infants, children. Now, let's talk about babies. For many EMTs, this is the scariest part. But remember, childbirth is natural. Women have been doing it for thousands of years without ambulances. Your job is mainly to catch the baby and keep it warm. Labor has 3 stages. Stage 1 is contractions. The belly gets hard, then relaxes. Stage 2 is when the baby comes out. Stage 3 is when the placenta comes out. We only help in stage 2. If the head is crowning, meaning you can see it, delivery is happening now. Prepare a sterile area. When the head pops out, support it gently. Do not pull. Suction the mouth first, then the nose. M, before, N. Once the baby is out, dry them off vigorously. This warms them up and makes them cry. Crying is good, it clears the lungs. If the cord is wrapped around the neck, nuchal cord, try to slip it over the head. If you can't, clamp and cut it. Now, for sick kids. Children are not just small adults. Their heads are big, and their tongues are large. If a kid is sick, look at the pediatric assessment triangle, PAT. 1. Appearance. Are they looking at you? 2. Work of breathing. Are they grunting? 3. Circulation. Is their skin pale? A common issue is croup. It is a virus that swells the throat. The kid sounds like a barking seal. Another one is epiglottitis. The kid will be drooling and sitting forward. Do not look in their throat, or it might close up completely. Just give oxygen and drive fast. Practice questions 1. What marks the beginning of the second stage of labor? Answer: full dilation of the cervix, baby enters birth canal. Explanation: this stage ends when the baby is fully born. 2. What is crowning? Answer: when the baby's head is visible at the vaginal opening. Explanation: this means birth is imminent. Do not transport, prepare to deliver. 3. What is a prolapsed cord? Answer: the umbilical cord comes out before the baby. Explanation: this is deadly. The baby's head will crush the cord. You must put your hand in and lift the baby's head off the cord. 4. How do you position a pregnant woman with low blood pressure, supine hypotensive syndrome. Answer: lay her on her left side. Explanation: the baby is pressing on the big vein, vena cava. Moving her helps blood flow. 5. What is meconium? Answer: the baby's first bowel movement, green, black fluid. Explanation: if the baby breathes this in, it causes infection. Suction the mouth immediately. 6. What is the APGAR score used for? Answer: to assess a newborn's health at 1 minute and 5 minutes after birth. Explanation: it stands for appearance, pulse, grimace, activity, respiration. 7. A child has a barking cough. What is the likely illness? Answer: croup. Explanation: the airway is swollen. Cool air often helps. 8. What is the first thing you do after the baby's head is delivered? Answer: check for the umbilical cord around the neck. Explanation: if it is tight, it can strangle the baby during the rest of the birth. 9. What is the normal heart rate for a newborn? Answer: 120 to 160 beats per minute. Explanation: babies' hearts beat much faster than adults. Anything under 100 is bad. 10. How do you treat a child with a high fever? Answer: remove excess clothing and cool passively. Do not use ice water. Explanation: ice water causes shivering, which raises body temperature even more. 11. What is placenta previa? Answer: the placenta covers the cervix. Explanation: this causes painless bright red bleeding. The baby cannot be born vaginally. 12. When do you cut the umbilical cord? Answer: after the baby is breathing well and the cord stops pulsing, usually 1 minute. Explanation: place 2 clamps and cut in the middle. 13. What is the leading cause of cardiac arrest in children? Answer: respiratory failure. Explanation: fix the breathing, and you usually save the heart. 14. A baby is born blue and not breathing. What is your first step? Answer: dry and stimulate, rub back or flick feet. Explanation: this stimulation often reminds the baby to take their first breath. 15. What is an ectopic pregnancy? Answer: the egg implants outside the uterus, usually in the tube. Explanation: it causes severe pain on one side. If it bursts, it causes massive internal bleeding. 16. What is abruptio placentae? Answer: the placenta rips away from the uterus wall early. Explanation: this causes severe pain and dark bleeding. It is often caused by trauma or drug use. 17. Why are infants' heads so large relative to their bodies? Answer: because the brain develops first. It makes them prone to head injuries and heat loss. Explanation: keep the head warm with a hat. 18. What is sudden infant death syndrome, SIDS? Answer: unexplained death of a baby during sleep. Explanation: there is nothing you can do but start CPR and support the parents. 19. How much blood can a woman lose during normal birth? Answer: up to 500 milliliters. Explanation: while this looks like a lot, the body is prepared for it. 20. A child is drooling and sitting in a tripod position. What do you suspect? Answer: epiglottitis. Explanation: the flap over the windpipe is swollen. Do not put a tongue depressor in their mouth. Section 6. EMS operations. This section is about how we work safely. The most important rule in EMS is, you are number 1. If the scene is not safe, do not go in. Period. If there is a shooter, a fire, or a weird smell, wait for police or firefighters. Let's talk about hazmat, hazardous materials. If you see a chemical spill, park uphill and upwind. This means the wind blows the fumes away from you, not toward you. Use binoculars to look at the signs, placards, on the truck. Don't walk up to it to read them. We also have mass casualty incidents, MCI. This is when there are too many patients for you to handle alone. We use triage. We sort patients by color. Filled circle green, walking wounded. They can walk. Filled circle red, immediate. They have severe airway or bleeding issues but can be saved. Filled circle yellow, delayed. They are hurt, like a broken leg, but won't die soon. Filled circle black, deceased. They are dead or have injuries so bad they won't survive, like cardiac arrest.